thank you everyone for joining me today for this leadership dialogue. I'm Joanne Conroy, President and CEO of Dartmouth Health and Board Chair of the American Hospital Association. And this will not only be our last leadership dialogue session of the year, but it will also be my last as chair of the AHA Board of Trustees. I've enjoyed bringing you these interviews throughout the year and updates from healthcare leaders across the nation who are happy to share their experiences and advice on the issues that we all face. As I get ready to pass the torch, I'm pleased today to introduce to you Tina Freese Decker, President and CEO of Corewell Health and AHA's incoming board chair. Corewell Health is an integrated, not-for-profit health system headquartered in Grand Rapids, but serving the entire state of Michigan. The system includes 21 hospital facilities with over 5,000 licensed beds, 300 ambulatory and outpatient locations, 65,000 team members, and includes over 12,000 physicians and close to 16,000 nurses. And as a health plan, they cover over 1.3 million members. Tina is a transformative leader known for working boldly to reimagine how we deliver care. She notes that care should always be grounded by humanity and heart. While she is passionate and driven when it comes to taking on healthcare's biggest challenges, she is also deeply committed to making sure that access to healthcare is simple, affordable, equitable, and exceptional. Tina spent much of her career at Spectrum Health, serving in a variety of roles, including president of the System Hospital Group, chief strategy officer, and chief operating officer, before being named president and CEO of Spectrum Health in 2018. Later in 2022, she was a key architect in the integration of Belmont Health and Spectrum Health, which are now unified as Corewell Health. And she continues to drive significant transformational change as president and CEO. Well, this is my last time hosting one of these discussions as chair of the AHA. Tina will be picking them up as she steps into the role of AHA board chair beginning January, and we could not be in better hands. Thank you, Tina, for joining us as we pass the baton, so to speak. Now, for those of you that have tuned in before, I always like to ask my guests to share a little bit about themselves. And we've made some modifications to the questions here, so we have a little bit more of a back and forth. But Tina, would you like to share with the audience something about yourself or your personal journey to CEO and president of Corewell?
Well, first, Joanne, I just want to say thank you for your strong leadership throughout the year. You've done a fantastic job leading the AHA. And I've really enjoyed partnering with you on many of the things that we've been working on as a board. Your steadfast approach, but always thinking about the people that we are serving, is so commendable and one that I hope to honor as we move forward. And I also love the fact that, as an anesthesiologist, you keep us on time and focused. But like I said to you before, one of the best things about an anesthesiologist is not putting people to sleep, it's waking you up. And you helped our board wake up and ensure that we are focused on the people serving every single day. So thank you for that. I think to answer your question about something about me, the big area is that when I got into healthcare, one of the biggest elements for this is that I like a challenge. And I want to make sure that we continue to do things going forward. And so when I think about this, I think about my grandmother. And my grandmother started smoking cigarettes when she was 11 or 12 years old. And when she was in her 60s, the doctor said, you're not going to live much longer. And she came home and she put her pack of cigarettes on the kitchen counter. And it stayed there on the kitchen counter for 6 years. I had 6 more years with my grandmother. She was my best friend, but she proved that you can do hard things. And that's what I think about all the time. We have healthcare field that is challenged in many areas and many aspects, and we're serving so many people and they need our help and support. And so as we all come together, we need to do those hard things for the benefit of our communities. And I'm ready for this challenge and so excited to be working with everyone in this field.
Well, thank you, Tina. We know we're in good hands. with you leading the AHA over the next year. Let's get to some of our questions. So often when we approach the holidays, we're thinking about the new year, and it's helpful to reflect back on the past year. Maybe identifying some of our biggest challenges, maybe considering what we could have done differently. What do you think have been the biggest challenges that you've faced in Corewell in 2024?
Well, it's been a tough year. As you said in the introduction, we have both a health plan and a robust healthcare delivery system. And the health plan, just like many other health plans in the country, has had significant utilization that has impacted everyone. And we are kind of in a down cycle. And the down cycle is not just in Medicare utilization or Medicaid utilization, but it's just been across the board. And so we've had to navigate that. On the flip side, from a healthcare delivery perspective, and we have amazing hospitals and outpatient clinics in Grand Rapids and West Michigan and Southwest Michigan, and also in Detroit and Southeast Michigan. And they've seen increased utilization as well, and that's taxed our team members. So I think about what's been going on in 2024. It's how do we continue to take care of our team? How do we help them do what they do every single day of the year? And to always be there to care for our community and to put their best foot forward. They've been through so much. And as I was rounding last week, I'm starting to hear we're coming out of this. We're coming out of the pandemic. And so they have this new outlook, but we need to make sure that we're still there for our team. I've seen some incredible things happening. For example, one of our security officers at one of our regional hospitals, our rural hospital, saw a patient that was leaving, didn't have anything, and was able to grab a blanket from his own car and give it to him because he knew he needed to have something to wrap up in. I met a little kid that we care for at our children's hospital, and he had two prosthetic legs. He calls them his robot legs, and he is just so excited to be an astronaut and a truck driver. And his mom was beaming because of the amazing care that was provided to him and the new outlook on life that he has. So all of that really comes together, and it's about the people that provide that care every single day. So that's where I think it's just essential that we continue to be focused and invested on our team, that we invest in the systems and the technology and the platforms so that our team can do what they do best, and that we're focused on doing what matters most. Because ultimately, we're here to serve our neighbors and everyone in our community, and they're counting on us to do that.
I would think that at Dartmouth Health, we have many of the same challenges. People are just feeling like they're coming out of the pandemic, but they are a little bit stressed in terms of the adequacy of the workforce to care for patients. I think when I look at Dartmouth Health, we have a aging population, and we're one of the three oldest states in the country. And our close colleagues, Vermont and Maine, are the ones that are usually 1 and 2 and 3 with us. And how do you deliver care in a different way that's probably a little bit more people intensive in their homes? I think that's the challenge that's going to face all of us. We have great hopes for the use of technology that may replace vacancies, but remains to be seen how effective that's actually going to be in the clinical setting. We are using the ambient listening technologies, which I'm sure you are at Corewell as well, to actually make the providers' lives a little bit easier in the office. However, we're talking about starting them to use them in the nursing units, because I think we underestimate the amount of paperwork our nurses do in caring for patients every day. And how could we use this technology to actually give them more time at the bedside, which is really, I think, where they get their energy from and where they find the greatest satisfaction.
Yeah, I love that we're helping people get back to why they went into the profession instead of doing clicks and typing and recording the data, which is all critically important to have so we can provide the patient care. It is about being able to be with people and help them navigate whatever they're going through. so that they can get to be a healthier state. And sometimes it's for the patient, sometimes it's for the family member. But just having the ability to get back to that, and it helps the person that we're caring for. It also helps us, because that's why we're in healthcare.
So when you look broadly at healthcare across the country, and we've had the opportunity at the board level to kind of listen to many of our colleagues and listen to the things that they struggled with and the things they've been successful in. What do you think we've really done well in healthcare over the last year?
So I think there's things that we've done well, especially with figuring out how to support our team members. I'm really proud of the workforce task force that was put together, and the amazing ideas. I mean, the compendium of ideas that was put together for the workforce was really helpful. And we need to make sure we're continuing to do that, continuing to advocate for our team members, for their safety, for addressing fulfillment and wellness, and the issues of burnout, just like we were talking about with ambient listening. And how do we get the resources and the technology and the systems in place so, again, people can focus on what they enjoy, and what matters most is the people we're caring for. I think there are a number of challenges, though, and we've been tackling those throughout the year. And I believe the AHA has been doing a good job with that. We also know that there's challenges coming forward, like the cost of healthcare, and we're going to continue to have that conversation about how do we address that. We've put together, as the AHA, a workforce on the payment methodologies that should be out there, and also on principles of health reform and what do we need to be thinking about. And I think that's extremely helpful to launch many initiatives from, so that we can continue to put the right things forward that don't just fit for the next year or the following year, but fit for the next decade and the decade after that.
I agree that I would say people have looked at our field and said, you can't really disrupt yourself. You have to be disrupted from outside. And yet we see so many people that said, well, we can fix healthcare, getting into the healthcare space and saying, wow, this is way more complicated and this is way more difficult to make a profit in this industry than we thought. And now they're exiting the organization, the field. I think, though, what we've learned from all that is when we're understanding how the disruptors work and understanding what they're teaching us, we are starting to disrupt ourselves internally. We are focusing on getting people out of the hospital. Remember, 20 years ago, people used to say you were successful if all your beds were filled. And yet now we say we are successful when we're getting people home faster. And we're actually keeping people out of the hospital rather than encouraging them to come to the hospital. Many of us are developing different ways of delivering care and pushing a lot of our stuff to the ambulatory setting. Now, if you think about it, years ago, people were admitted to the hospital for 3 to 5 days for a joint replacement. And now the expectation is that with all of our prehab and our supportive physical therapy and home care, they don't stay a night in the hospital. And when you look back, you say, wow, that is actually a huge shift. And so we are disrupting ourselves. Your work on the pathways, which is, how do we deliver care differently, I think was really important for the AHA to think about disruption in a controlled, effective, sustainable way.
And I think you're right. We are disrupting ourselves well. Is it at the pace that we need to? Probably not. But we're also trying to take care of a population that needs us, and it's an evolution. And so I think the challenge will be figuring out what the pace is and how fast can we go, or how slow can we go, and what do we need to do.
Now, you're looking forward to your year in 2025 as AHA chair. What's top of mind for you? What are the priority areas that you want to focus on over the next year?
Well, Joanne, as you and I have been working together over the past year or several years, I think as we talk to many others in the country, but also outside of the country about healthcare, we have some similarities. We're all seeing that we have an aging population, and so the demand for services is increasing. And I believe healthcare needs will become more complex. and then add on to it some of the pharmaceutical breakthroughs that are coming forward, which are truly amazing, but we have to figure out how we're going to pay for those because it does put a financial strain in healthcare. The workforce availability will continue to shrink. Again, aging population, people will be retiring from working in healthcare, and new generations coming in have different expectations of what the work is and how we navigate that. So we'll have to do that. And then the third is funding. We all see that to care for an aging population, a more complex chronic disease population, as much as we would like for them not to be in the hospital and to be as healthy as possible, we are still dealing with an unhealthy population and people that unfortunately have some illnesses. And so we need to figure out how do we fund this in the most appropriate way. And people across the country are tired of healthcare costs going up, and they want to see greater value for what they're getting. And I think that ties into trust. Through the pandemic, we had a lot of trust. I think that trust in general in institutions has decreased. And so we need to focus on building back that trust. And part of that is having honest conversations about the value that we provide and what we need to do as partners in the communities, as partners with people on their health. So those are a couple of things that are top of mind for me. And especially, we're going to have to focus on those, but also we're going to have to navigate a new administration. And there's knowns and there's unknowns as we go into that. But the AHA is very strong. They know how to work with various administrations. And I feel that we'll be able to work together as we figure this out and advocate for the best interests of the field and the best interests of the neighbors and the people that we serve every single day.
I totally agree. And I would say that, if we just stay focused on the patient and delivering really high quality care that people can afford, we'll make all the right decisions. And it's shifting our focus maybe from the business operations to the impact that we have on our communities. And that's something we have to talk about every day. And it's something we have to deliver on every single day as sometimes the largest employers in our state and often the largest employers in our region. And it's both it's a responsibility as well as an honor to actually be able to participate in that way. So,
do you have any other advice for me as incoming chair?
Well, you do a pretty good job, as I've observed you as chair-elect. But I would say, number one, just intentional listening. Just listen, and I usually talk last rather than first, giving everybody in the room an opportunity to really participate in the conversation. And as we've talked about before, I always ask the question, what could go wrong? Because things do go wrong. The unexpected happens. And you're just far more prepared if you've mentally gone through that process of what could go wrong when something does happen. And but you have fabulous leadership skills, Tina. I have complete confidence in your ability to lead the organization through some times that are going to be challenging. We know that our revenue streams and our ability to really help our communities can be affected by the legislator's signature on some of the payments that come to hospitals, either for our graduate medical education, our Medicaid patients, our programs that are critical to the community. They can be affected. And we just have to be able to be prepared mentally and organizationally to continue to deliver the services that our patients need. So anyway, you are going to be fabulous. What I'd like to do, though, is I've got a lightning round of questions for you, just so people actually really get to know you a little bit better. So as a kid, you thought you'd grow up to be what?
An architect.
Oh, wow, that's interesting.
And I did go into industrial engineering, but yeah, I always loved to design things.
Oh, wow. So are you very involved in your facility projects at Corewell?
I'm not anymore. As CEO, you got to stop doing certain things, but it's just always interesting to see how things come together. And it's some of my passion is how do you make things easier, simpler for both the patients and also the people providing care. And I think part of this architect is as I mentioned, my grandmother who suffered from when she was smoking. She had a oxygen tank, and we call it a little leash that had to follow her around. And so you saw the things in her house that didn't work and how the oxygen cord got tangled up in everything. And so that just made me think, how do you make housing easier for people to navigate when they are when they need certain medical attention? And so it's those sort of things that just really intrigue me.
Yeah. That's interesting. When I was an undergraduate, I was thinking about doing a major in religion, music, and architecture. Because when you think about it, um, it creates the environment that we live in.
Right.
The physical environment, the artistic environment, and the spiritual environment are actually very connected. And I think we shouldn't underestimate the message that our facilities actually send patients when they walk through the door.
I agree completely.
So, second question, your favorite subject in school was?
I would say it would be math or chemistry. I loved both of those.
Oh, it's something we have in common. I was a chemistry major and a math minor. So, no wonder we get along so well. What's the worst job you ever had?
Oh, well, I could probably it wasn't the worst job, and I learned a lot on it. But I my first job was at Pizza Hut, and I was a cook. And let's just say there's certain things I will never eat on pizza again. Um, but you learn a lot by working in the back of a restaurant, and how do you navigate the different team environment there, and then getting things done in a productive way.
You know what? Healthcare is a hospitality
Yeah.
industry. If
Yes.
anybody has any questions about that, all you have to do is actually work in a hospital.
Yeah.
What's one piece of advice that you would give your teenage self?
Um, Probably slow down. Just take time to be with family, to be with people. Just it's. I believe relationships are so critical, and you learn so much from them, whether they're mentoring relationships, family relationships, your team development relationships, and so it's just giving yourself more time to cultivate and foster and develop those relationships that can last a lifetime.
How do you like to start your days?
Well, I usually like to start my days exercising because I know at the end of the day it's not going to happen. So I want to make sure I get that done because that's important to me to do. And then, I'm more of a morning person to get things going, and I like some of that quiet time at the beginning of the morning just to think.
Yeah, I do Wordle. Now, how do you end your day?
I do Wordle at the end of the day. So don't tell me the answer.
How do you spend your free time?
I love just to be with my family. I have two kids and a loving husband and a dog. And so it's with them or traveling, exploring new places to learn about, reading. I read a lot and love to play sports with my family and or other games.
You are a voracious reader. You put us all to shame with the number of books you read and how quickly you read them. I'm impressed every time I travel with you. So, one word to describe how you're feeling about stepping into the chair role at the AHA.
Oh, I only got one word. Um, I'll go for optimistic. I think that I'm very proud of the AHA, and I believe in the AHA and what the team can do. And I think there's a lot of things that can come to my mind, but I believe we have to be focused on how do we partner and move forward. And so I'm going with optimistic.
So, any closing comments, Tina?
I think that first, I just want to say, Joanne, you've done a fantastic job. thank you so much for all that you've done this year. And you've been a great partner and mentor so that I can take the advice and apply that, as well as some things that I'll bring to the table and help the AHA move forward. It's been wonderful to get to know you and to watch you lead. And I'm just really looking forward to working with all of our members on behalf of our members to help the AHA move us forward. The AHA really believes in our membership and what we do every single day to take care of our patients and our neighbors and our communities. And we'll make sure that that is the focus as we go forward in this challenging environment, but that we believe in partnership and we believe that we can make that we can achieve the objectives that we set forward. And I look forward to working with everyone.
Well, Tina, thank you again for joining me today and for sharing your insights. Your perspective is both helpful and inspiring. And the AHA board is very fortunate to have you as their leader in 2025. I want to thank you one last time for everybody that sees Leadership Dialogues and who's joined me over the last year. As I said when we first began last January, there's great value in listening and learning from one another. And I know those valuable lessons will continue next year as Tina takes the reins, hosting these peer-to-peer discussions as AHA board chair. Best wishes to all of you for a happy holiday season and a healthy and peaceful 2025. Thank you.